Welcome to this quick guide on precision medicine, cancers you can inherit.
Genes, which make up your DNA, are molecules inside your cells that you inherited from your birth parents. Genes tell your cells what to do. Some genes tell your cells when to grow and divide. Others tell your cells when to stop growing and dividing.
Your body adapts to the world by turning genes on and off. Genes may be turned off or on in response to things like changes in your diet or your environment. Sometimes genes are inherited with changes in the DNA called mutations. Very small changes in the DNA can sometimes cause large issues like cancer. Some inherited mutations can raise a person's cancer risk later in life.
About 5 to 10% of all cancers are linked to a genetic mutation a person inherited from their birth father or their birth mother. Types of cancers most often traced back to genetic mutations you can inherit are breast cancer, colorectal cancer, ovarian cancer, pancreatic cancer, stomach cancer, and uterine cancer. But there are also others.
If you or a relative has one of these types of cancer, it doesn't mean that you have to test for a genetic mutation. Most cancers are not inherited. However, if your family does have a history of a cancer-related gene, you should talk with your healthcare team about doing regular screenings to find any abnormal growths early. Testing for a genetic mutation that you inherit does not automatically mean that you have cancer or are going to get cancer.
Talk to your doctor or genetic counselor if you are interested in getting tested. They can help you decide if genetic testing makes sense for you. A genetic counselor is someone trained to help you choose if testing is right for you. If you get tested, they can also explain your results.
Blood or saliva samples are typically used to test for inherited genetic mutations.
Testing positive for an inherited genetic mutation does not mean that you will develop cancer. It does mean that your risk of developing cancer is higher than it is for someone that does not have the genetic mutation. It can be scary to learn that your risk of developing cancer is higher than average. But by knowing you have the mutation, you may be able to take steps to reduce your risk. You can reduce your risk by seeing doctors who treat patients with an increased cancer risk, having additional cancer screenings, quitting smoking, eating a healthy diet, taking certain medications, and having the area where the cancer would develop removed.
Testing positive for an inherited genetic mutation does not tell you your exact risk for developing cancer or at what age you might develop cancer. However, it may tell you which types of cancer you might develop.
To understand more, let's listen to some first-hand experiences with genetic testing for inherited cancers. I'm 30 years old and healthy. My mom and sister have both had breast cancer, and they recently tested positive for a mutation in a gene called BRCA2. Having this mutation puts women at higher risk of developing breast and/or ovarian cancer. Even though I've never had cancer, I decided to talk to a genetic counselor. After that appointment, I decided that it made sense for me to get tested. The test showed that I have the mutation too. The genetic counselor helped me deal with the shock of learning this and explained to me what it meant. Then, we made a plan for reducing my risk over time. My husband and I plan to start our family soon. Once we have children, I'm going to consider surgery to remove breast and ovarian tissue from my body.
I'm 45 years old and in treatment for colon cancer. Since my mother had ovarian cancer, my doctor suggested that I speak with a genetic counselor. After meeting with the counselor, I chose to get tested for mutations linked to colon cancer. I learned that I have an inherited genetic condition from one of my parents called Lynch syndrome. People with Lynch syndrome have genetic mutations that increase their risk for several types of cancer. The genetic counselor helped me deal with the shock of learning that I have this condition. We also talked about how and when to tell my kids about it.
We noticed one of our daughter's eyes crossing at times. We thought it was just a lazy eye, but our pediatrician referred us to a specialist. Gayla was diagnosed with retinoblastoma, a cancer that begins in the back of the eye. Children who don't inherit it only develop a tumor in one eye. Since she was diagnosed with it in both eyes, we were fairly sure that it was hereditary. Our doctor arranged genetic counseling for us. The counselor explained what the risk might be for Gail, and for our Gail's soon-to-be-born little sister. Should Gail test positive for the genetic mutation that's linked to retinoblastoma, we decided to go ahead with testing, just to be aware how closely we should be monitoring our children going forward. Should any other types of cancer develop in Gail or her little sister, we want to catch them as early as possible.
Testing for whether you inherited a higher risk for cancer is different from testing for cancer biomarkers. Testing for inherited genetic mutations is testing done on your genes to see if you have an increased risk of a specific cancer, and if that increased risk can be passed on to your birth children. Testing for cancer biomarkers is done to find out more about your cancer. Biomarker testing helps your doctor understand what is unique about you and your cancer on a molecular level. The tests identify biological markers or biomarkers in the tumor that tell doctors what treatments are likely to work best for your cancer. To learn more about testing for cancer biomarkers, see our short guide on biomarker testing.